Today, 3 psychedelic compounds, 3 very different patient experiences, and what that means for who you might offer them to. So a patient asks the same question before any psychedelic consult. What will the trip actually feel like, and how long will it last? For psilocybin, DMT, and 5-MeO-DMT, the answer is wildly different, and those differences matter for patient selection. All 3 are serotonergic psychedelics, acting primarily through the 5-HT2A receptor, but the receptor profile is not identical. 5-MeO-DMT also hits 5-HT1A strongly. N-DMT also engages TAR1 and sigma-1. Still, 5-HT2A is the common anchor, and that is why the subjective experience diverges so sharply. Psilocybin is the long one. A single 25 mg oral dose produces a 4 to 6 hour experience. Gradual onset over 30 to 60 minutes. A peak around 2 to 3 hours with mystical-type phenomenology, visual hallucinations, ego dissolution, and what researchers call emotional breakthrough, a release of affect that predicts therapeutic response. The session requires a therapist present throughout, plus 14 hours of preparation and integration around each dose. N-DMT is the opposite. Vaporized or intravenous, the experience peaks within 2 to 5 minutes and is largely over by 20 to 30. The phenomenology is visual and immersive geometric patterns, perceived entity encounters, what users call hyperspace. The intensity is high, but the duration is so short there is little time for emotional processing during the session. Trial adverse effects were mostly mild, transient anxiety, nausea, infusion site pain. No prolonged therapy component was required in the trial protocols. 5-MeO-DMT sits in the middle. Onset within seconds if inhaled, duration under 1 hour. The phenomenology is distinct from N-DMT, less visual content, more of what users describe as a content-free whiteout, an experience some find ego-dissolving and others find disorienting. It is 4 to 20 times more potent than N-DMT per milligram, which matters for dose selection and monitoring. No formal psychotherapy component was required in the GH001 Phase 2B protocol. Operationally, this is where the differences become concrete. Psilocybin, a 6-hour session, therapist present throughout, plus 14 hours of preparation and integration. N-DMT, 30 minutes, therapist monitoring, no prolonged integration protocol in trials. 5-MeO-DMT, under 1 hour, supervision required but no formal therapy component in the GH001 protocol. Same clinical indication, very different staffing model. Patient selection overlaps heavily across all 3. You exclude psychotic disorders, bipolar with psychotic features, uncontrolled cardiac disease, and pregnancy across the board. The mechanism is the same serotonergic agonism in a vulnerable brain can destabilize. Outside those shared exclusions, the choice between compounds is largely a clinical judgment call about which patient profile fits which experience profile. But there are differences worth flagging. N-DMT causes acute blood pressure and heart rate elevation. Cardiovascular screening is essential before dosing. Psilocybin trials reported 4% suicidal ideation on dosing days and 1 case of hallucinogen persisting perception disorder. Monitoring intensity matters. 5-MeO-DMT's high potency means small dose errors are clinically significant, and long-term safety data in chronic use remains limited. Bottom line, psilocybin, DMT, and 5-MeO-DMT share a 5-HT2A mechanism, but offer 3 very different patient experiences. The right compound depends on the patient in front of you, their cardiovascular risk, their monitoring needs, their capacity for a 6-hour session, and which experience profile they themselves can work with. None of these are FDA approved. All 3 are still in clinical trials. For questions or episode ideas, drop them below and subscribe for more psychopharmacology breakdowns. Educational purposes only, not a substitute for clinical judgment.